Dr. Tom Roselle live right now, 630 WMAL.
This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live. I'm in studio, 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject. Talking about several very interesting things, and our caller coming in that I'm going to take next is kind of preempting a topic, but we're going to get into it anyway. Natural sleep solutions. And Laura, are you waiting? Laura.
Hi, hello, Dr. Roselle.
Hello, my friend. How can I help you?
You want to call? I love your show. I'm addicted to it.
Well, thank you very much. I appreciate that.
Thank you. I have three quick questions. The first one was the melatonin. Is there a side effect taking that, or does it affect you? Do you get addicted to it, or?
The answer is you can get addicted to it, meaning that your body begins to depend on the chemistry that you're putting into your body. But yes, there are many side effects. When you're taking melatonin has the capacity to alter a lot of your hormone functions in your body. And it works very well for certain people, and it can be used, obviously, for sleep. It's a hormone that's found basically in every organism that exists. The levels of melatonin inside and the body varies in a very, very specific level depending on not only the person, but also the amount of sunlight that you actually get. Melatonin is produced by a little organ in the brain called the pineal gland, and it helps the body know when it's time to go to sleep. Now, one of the reasons that we get so messed up and our melatonin levels kind of get altered is because at nighttime, as night approaches, we should begin to quiet down. We should be turning the lights down. We should actually not watch television because it's very stimulatory to the brain. And, over a period of an hour and a half or so, get into a place. And we should sleep in total darkness. We shouldn't sleep with any lights whatsoever in our bedrooms. It's not even the ambient lights of clocks. Those shouldn't even be there. But unfortunately, we do that, and it begins to continue to stimulate that pineal gland and not allow it to work the way it's supposed to work. Now, the dosages some people take are anywhere from 1 to 3 to more milligrams of melatonin at nighttime. I occasionally will use melatonin when I'm traveling internationally. I'll take 1 milligram for one night or 2 nights to reset my normal biorhythms, my clock, but I don't stay on it longer than that. The problem is when you have to take melatonin is that sleep cycle is being altered. So the most common side effects that you need to know about are things like headaches, and they will really mess up your sleep patterns if you don't already have a problem there. It can cause mood changes and mental changes, your ability to think quickly. There's itching. Your heart can kick in, and you can go into a rapid heartbeat. There's a term called heavy-headedness. That means your head feels really heavy. That's one of the side effects, and it can cause your body temperature to lower. It can affect your thyroid because of that. You can also deal with some unbelievably crazy dreams when you're taking too much melatonin. And there's, the list goes on. There's actually a whole lot of different things. You have to be careful with it. I would not recommend that you take it ongoingly. I wouldn't take more than 1 milligram without a doctor monitoring for you. But most authors say that 1 milligram to 5 milligrams is considered safe. But I would start very low. I'd even start at a half of a milligram, and I wouldn't get above maybe 2 milligrams a day, and I would leave it at that. I wouldn't go beyond that unless you have other things checked first. And the problem is those things that we've talked about, and they can be quite significant. So be very, very careful with it.
All right. The other question is related to the arthritis that you were talking about.
Yes.
I do have some arthritis. I do have arthritis, especially in my fingers. And I've been taking turmeric and bromelain, eating pineapple. Is that enough? It helps me a little, but you think this is enough?
All of those things will help, but it depends on the individual person. Arthritic conditions are a inflammatory response. Well, arthrosis first is just breakdown of the joint. The itis part of arthritis is inflammation. So what you have to look at is what's causing the inflammatory response to begin with. There's only three things that cause anything, is injury to the body, stress patterns, and diet. So you have to look at those three components to find out where the inflammatory reaction is and then change that. If you change that, then the other things that you do, whether fatty acids or curcumin and phosphatidylcholine and so forth, they have a greater chance of working with the other enzymes. Laura, I'm sorry, I'm coming up against the news.
Thank you, Dr.
Thank you for calling. I appreciate it. Bye-bye.
Thanks.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I am live in studio. 888-630-9625. 888-630-WMAL. Love to talk to you. Any subject that you have in mind. We're talking about a whole bunch of little things today, so things that make your life different. And want to get back to that melatonin piece just for a half a second, because I didn't quite finish all the comments that I wanted to make on. Actually, I could spend the whole program on it. Melatonin is something that we've actually used in practice for many years, and it can help a lot of things, but you always want to get it from the natural source. It's called your sunlight. And melatonin is a great antioxidant. It works actively both in water suspension and oils, and with vitamin C and glutathione added to them, they can do some really great things. Then you add the ACEs, the vitamin A, C, E, and seleniums. It helps prostate cancer protection, and we can go on and on. But having said that, please do not go out and start taking tons of melatonin because of the other side effects that can cause some real nasty problems. You can probably get away with 1 milligram, you can get away with 2, but at that point, if you start having any of the symptoms that we talked about, please stop and see somebody who really knows what they're doing. It has some excellent effects, particularly those of you who are cave dwellers. You add that with a little bit of vitamin D, which you all should be taking, and from sleep to protections of immune function to cancer protection and so forth, it does a nice job. But again, don't go out and take this stuff, because this is one hormone that can cause some significant side products. So, having said that, I will leave that in for a different day. And if you really want to sleep well, make sure you're in a dark room. Make sure you go to bed relatively early. Your best sleep is before midnight. Wake up at a standard time all the time. Don't mess around with your sleep cycle. You need to go to sleep the same time. You need to get up at the same time. And the bedroom, you've heard me say before, two things, sleep and play. But we're talking about intimacy here. We're not talking about leave the computers off, turn the television off, don't listen to anything. You need to go to bed. And if you can't sleep, get up. Get out of the bed. If you're awake more than 20 minutes, then, there's other problems. That can be a GABA pathway problem in your brain. It could be a tryptophan problem. And try to write things down. If your brain is constantly occupied, Connie, who's head of the acupuncture department and a partner in the practice, will tell you that's a spleen problem and that you have to deal with that accordingly. But spleen also GABA, so we're gonna be doing a lot of work with that. And avoid daytime napping. If you can't sleep at nighttime, if you take a nap during the day, you're kind of making life a whole lot more difficult for you. So, it goes much more in depth than what we're talking about now, but those things will help. Tryptophan, you can get it now on the market, thank God. That in combination with B6 increases your serotonin pathway, and you end up in a better place, and you will sleep better because of it. Now, before we get into some really interesting other things, I want to go back to the phones because we have people lining up, and I don't want to ignore you. Richard, how can I help you, sir?
Dr. Roselle. Back to Mariva.
Uh-huh.
I'm 265 pounds.
All right.
I have Mariva, and it's a brand which says Mariva SR after the word Mariva, and it's put out by Thorne, and it comes in 250 milligram capsules or tablets. How many of these would you use?
Okay. Did you get it from a doctor?
I got it from knowing about it.
Okay. It's very difficult. I'm surprised that you did get it because Thorne usually won't sell to anybody except for physicians. But having said that, I don't know you, Richard.
I got it. You would know me. I've been to your clinic to
Oh, okay. But I don't know your health status straight up, so it's very difficult to prescribe dosage.
Mm-hmm.
I would try maybe 2 a day, and I would take them with meals. And actually, I would take it before you eat anything, and I would leave it at that level. until whoever's going to monitor you can tell you and can test you and tell you what levels that you should. Now remember, whether it's Meriva or if it's anything else that you're taking, the inflammatory pathway problem is what is suspect here. And you have to look to see what's causing the inflammatory pathway problem.
I mean, I do have diabetes for a long time.
Yeah, so by definition, you're heavy, you have diabetes, and I'm sure that if I explored it deeply, you've probably got all the pieces of metabolic syndrome. And so you've got to look at the dietary pathways, you've got to look at injury pathways, you've got to change those things, because no matter what you take, if you don't change the underlying why is that, what's causing it to begin with, you'll never change anything. And this just becomes, you have to take more of something to make any kind of effect. And, whether it's Meriva, whether it's a natural product, whether it's vitamin C, vitamin A, doesn't make any difference. If there's a continued deficiency that's being created in the body, there's a reason for that, and you have to deal with the why and not just. Here's a situation: Meriva is a great product, but we have to be careful that we don't use it as a drug.
Right.
Because nutrition can be used as a drug, and that's not okay, because we're looking at one side of the triad at that point. We're looking only at the biochemical side of the triad. We're not looking at the other pieces. So without knowing the other things, I would say to you, you can probably get away safely with 250 milligrams twice a day. And the other piece of it is, I know the pathways on this thing, but I don't have a lot of clinical experience with Meriva simply because it's new. It just came out within the last year. And, so go from that. If you're in the office with one of our docs, talk to them, and, but please go after the underlying problem, okay?
Yes. Now, are you familiar with a product called Nurophentine?
No, I'm not. What's in it?
Nurophentine. It's to be used for neuropathy.
No, I can't tell you that I am.
Neurofencine. I've never used it, but Dr. Pollock told me about it.
NEU?
NEU.
ROTIN?
F, as in Frank, ENCINE.
No, I'm not familiar with it at all.
Mm-hmm.
That's not one that I've used or I've had any experience with. You got me on one.
Yeah, and they told me that for nervehealth.com. I don't know if that's exactly the website. There's information about it.
Well, I'll tell you what. Do me a favor.
Yes.
Send me a note at rosellecare.com, and within the next 24 hours, I'll be an expert on it.
Okay.
And then you and I will have a discussion.
All right.
All right.
Okay, thank you very much.
Richard, thank you for calling. I appreciate it. 888-630-9625, 888-630-WMAL. Love to talk to you on any subject. Every once in a while I get caught with a product that's out there that I'm not familiar with, and I'll tell you that I'm not familiar with it, but I'll find out. So if Richard will call or write me and send me a note, I will find out, and I will get back to him. I want to remind you, coming up in September, Ageless Health 2011. And what that is all about, that's our annual keynote event. That's the one that you go to change your life. It's a comprehensive look into wellness healthcare and how to change your life. We will give you the tools. We will give you the capacity. Those of you who've been there know it's a sold-out event. Don't wait. Call our office now and get the information on it, 703-698-7117, or go to rosellecare.com. That's ROSELLECARE.com. We are just starting to get things up, but please, please, please register early. Those of you who have gone in the past will receive a special invitation from us. However, don't wait, because it's a sold-out event. There'll be no discounts towards the end of it. I encourage you, if you really want a jam-packed day and something that you'll never forget, something that you'll be able to apply. If you decide you want to change your life, this is the event that you have to attend. September 17th, it'll be at the Marriott Fairview Park in Falls Church, Virginia. Love to have you, love to see you, love to make a difference in your life. Get a hold of us at 703-698-7117 or go to rosellecare.com.